So as she's doing the fundal massage, just making sure that she's massaging it correctly, and this can just help with contractions, just to make sure that it's going back down to pre-pregnancy size. Also helps with bleeding. Next, I would go ahead and I'm going to go ahead and put my gloves on, because I'm going to go ahead and check the lochia, which is the discharge from the vagina that's normal after birth. And there's different stages. The first stage after delivery is rubra, and that is the bright red. So I would just tell her what I'm doing, that I'm peeling back her pad, so I can go ahead and just take a look at the color, the amount. If there's any odor, I would educate her as well to go ahead and notify if there's a strong odor, because that could be a sign of infection. I'm looking for any clots. There shouldn't be any clots. Some of it can be kind of stringy. That's normal. And then I would ask her when the last time she changed it. If it was more than an hour ago and it's like completely saturated, that would be a cause for concern. That could be hemorrhaging. So we want to make sure that we go ahead and do that fundal massage to help stop the bleeding, and then notify a physician. I would also check her episiotomy if she had one, which is that incision that they make from the perineum just right above the anus. Ask her if she's having any pain with that. If she is, I would just let her know that it's common. If she's had any stitches, they might feel kind of like a burning sensation. And then I'm also checking for Rita, which is the redness, edema, the bleeding. I'm looking for approximation, and then lochia as well for the discharge. I would also check for hemorrhoids if she has any of those, and then just reassure her not to strain during a bowel movement, because those can make it worse. If she had an epidural, we would check the epidural site just to make sure that everything's healing up okay as well. I'm gonna go ahead and take off my gloves. And then I'm gonna check the Homan sign. Or just tell her that this is just checking for DVTs, which can be common in pregnancy overall, and then especially after birth because the decreased activity, she's not getting up and moving. So I just place my hand right underneath her knee, and then I would just take her foot and then just push it forward quickly, and then just ask her if she felt any severe pain. Also check the clonus for hyperreflexation. I would also, during my assessment, I would be able to kind of see if she's a little emotional, any crying. I would ask her if, she's having any baby blues, or if she's talkative, if she's looking you in the eye while you're speaking to her. If she's a C-section mom, I would go ahead and also look at her incision. I would tell her the proper care for that incision as well.